Glasses are just something we wear on our face to make the world less blurry. Sounds right, doesn't it? Well, guess what? It's not that simple. Sure, glasses help to see clearly, but they can also do much more. Did you know, for example, that the right pair of glasses can actually help with migraines, stop double vision, and even make you more productive if you're looking at a screen all day? Today, we're going to explore the amazing potential of specific eyewear for specific vision conditions. So, joining me is Paul Graham, lead optometrist and owner of Harmony Vision Clinic on the Gold Coast. Paul knows the ins and outs of how glasses can do more than just sharpen your vision, they can improve your whole quality of life. So, if you've ever wondered if the right pair of glasses could do more for you, you're in the right place. But first, who am I? My name is Paul Salloway. I'm the owner of Optics Digital Marketing, an agency that helps independent optometrists to grow their practice. So, hi, Paul. Good to see you again.
Likewise, Paul. Happy New Year.
Yeah, Happy New Year. Another year's rolled around.
Yes.
So I don't know about you, but like in my YouTube feed, I get a lot of see a lot of videos about eye care and eyewear. I've noticed some recently that talk about like smart glasses, like I think Meta and yeah, Meta and Ray-Bans. That's right. They've got some smart glasses with cameras and whatever, and there are others coming out now. They've got like AI assistants and a lot of this type of stuff. So, and it made me think that glasses these days are more than just solving, prescription refraction issues. They're even more than just protecting our eyes from UV rays. So we actually, use glasses for a whole lot more than that. And no doubt in your practice, glasses are and lenses are an important tool in what you do. So I thought that would make a good topic for us today.
Yep, absolutely. Yeah, and obviously when people think about sort of seeing the optometrist, glasses are the first thing that come to mind. And one of the things we'd like to talk about that good vision is more than just being able to see clearly. There are plenty of other things we can do with lenses and glasses that can improve your quality of life uh, based on what you're presenting with.
Excellent. So maybe the first one I'd like to talk about is lenses, glasses that help with migraines. A fairly common thing, unfortunately, and there are a lot of different triggers for it. And but I believe light is a very common one. So can you tell us about how migraines are related to vision and what type of lenses can help with that?
Yeah, look, and certainly there are a few different types of migraines, and what we look at are the ones where light flicker or light or brightness of light can be one of the triggers for a migraine. And the other side of it is that once you actually get a migraine, a lot of people become very light sensitive. So one of the common sort of things you hear about when someone's having a migraine is that they need to go and find a dark room to hide themselves away in while it sort of passes because the light sensitivity they get during a migraine attack is almost debilitating in many
Mm.
cases. And there's been some tints around for a long time. The FL-41 is probably the one that a lot of people sort of know about as a classic migraine assistance. And look, none of these are cures. The idea is that we're just trying to improve quality of life around migraine. More recently, there's been one where Avulux is a specific type of tint that was specifically targeted and researched to look into light sensitivity with and without migraine. And they discovered that there are frequencies, light frequencies or wavelengths on either end of the spectrum that are pain inducing. So there's some in the blue and there's
Mm.
some in the amber. And they also found that there are green wavelengths that actually reduce pain. And so they combine that together in a tint. And what they basically look at, it falls into two categories of uses. You get the people who know a migraine is coming and start wearing the tint in order to make sure that the migraine that follows is not as severe. So they can get on with the day, they can still be productive, they don't have to kind of lose a day or more to recovering from a migraine. And then you get people who maybe know what certain light situations may trigger their migraines. They may use the Nebulux tint in those kind of situations to try and avoid the migraine being triggered to begin with. And certainly people who get migraines very frequently, 2 or 3 times a week, might choose to wear a tint if they find it useful to reduce the number of migraines and the severity that they get.
Mm.
And the challenging part of it is that, this is something that we need to trial. Not everyone responds, but that's why we set up a trial sort of situation for the right patient who presents with migraine. We obviously also want to, so anyone who's got a new migraine needs to have a full health and vision check done just to ensure that it is a migraine and not symptoms of something that could be a bit more serious. But once it's that they're medically satisfied that it is migraine, then and there is an element of light sensitivity in leading up to it or during, then the Avulux makes a tool that some people find beneficial in managing their symptoms.
And those are actually lenses. They're available as prescription lenses as well, aren't they?
Both, yeah, yeah.
Yeah.
So if we do a trial and we find someone, they find that the Avulux improves their symptoms, then they can get it as a fit over so that when an attack's coming, or if there's a particular situation where they know that tint is beneficial, then they can get a frame. This is not a fit over, but it's like the old fit over sunglasses that go over the top of
Mm.
your glasses. So it gives you some flexibility of having your prescription glasses on and then just applying
Right.
the tint as you need it. For those people who like to work in their Avulux tint or find that they're wearing it a lot of the time, and so then we can make them up as an actual prescription with the tint
Right.
in there. And
Right.
there is an Australian lab that has the distribution license and rights to make the Avulux tints in Australia.
Okay. So you can put those lenses into somebody's existing frames if that's what they want then.
Yeah, yeah. So it's a whole new lens. It's not a tint that we can apply to existing
Mm.
lenses. They have to make the lenses from scratch.
Okay. So when would you suggest like Avulux versus the FL-41 lenses? Like how would you make that decision about who's, best suited for each of those types?
Yeah, look at and that's the tricky part sometimes with color. Sometimes, someone may even benefit just from a simple gray lens, just reducing the overall amount of light that they're
Mm.
dealing with.
Mm.
Whereas others have to be, some people are very specific it appears in the color of the tint that actually makes them more comfortable. And we can talk about it a bit more when we get into sort of pack and glare
Mm.
later on. And I have probably more experience with the Avulux because it looked a little bit more comprehensive in what wavelengths it was dealing with.
Mm.
And it's probably just from a, wearability point of view, it's a more neutral looking sort of tint. It's not quite so
Mm.
obvious.
Mm.
And we always so we do a questionnaire on when someone gets their light sensitivity, how it sort of operates. And then if they look suitable, then we offer the trial. Certainly we can do some sort of chair side assessments because you get some people who are sensitive and you put them on and they may immediately dislike that color personally. And
Mm.
that's what we might look at. Or maybe an FL-41 tint of some sort might be more suitable.
Mm. So it's the FL-41s are the rose tinted ones,
Yes,
aren't
that
they? Yeah.
rose colored. Yeah. Yeah.
Literally looking at the world through rose-colored
Rose colored
glasses.
glass. That's right.
So would like one of those types better for outdoor use than the other, or was it sort of like much and muchness really?
Much for muchness. I mean, I tend to think that the tint color in the Avulux is a little bit more natural. So it can be worn outside. Some people who find a tint beneficial still want something a little bit darker. So they might move
Yeah.
to a traditional pair of dark sunglasses in that time. Again, some people don't like sensitive to even polarizing. So this is some of the things you've got to kind of
Yeah.
find your way through. Yeah.
All right. Interesting. Okay, well let's talk about double vision and an approach that I understand you take, which is occlusion. Now I've heard about occlusion. I think that's similar to patching, isn't it?
Yeah.
Which
Exactly.
might be something that traditionally we've done with kids when they have lazy eye, but maybe I think there's more to it than that. So can you tell us a little bit about occlusion and how you use that with different types of eyewear, for example?
Yeah. So we have one visual world that we perceive, but we've got two channels, and so our brain has learnt how to integrate those two bits of information together to create this single perception of the world. And there are times where someone's ability to maintain two eyes looking in the same place in space can be impacted on something congenital, or a lot of the cases we're dealing with after an injury, a brain injury of some sort, where a muscle movement gets restricted, either through the nerve damage or the muscle itself being damaged, in which case that might be that they have single vision looking straight ahead, but as soon as they look to the side, they start to get double vision or looking up, or they may, you get some very different and sort of fascinating restrictions in eye movements from brain injury. And we see it from anything from a traumatic brain injury to post-surgical kind of things. And you might have someone who's got full movement on one eye, but the other eye can't move up and down. So it creates diplopia or double vision in different environments. And one of the classic ways of managing diplopia in someone who's had a brain injury is to simply just patch the whole eye. And in some cases, some people's double vision is temporary. So that's, maybe a satisfactory thing if they recover within a few days or a few weeks, you're able to take away and they go back to their regular single view of the world. But for someone who's got more long-term double vision, particularly if it's in one field, you're sort of blocking this entire field of one eye when you could be more selectively occluding part of it. So we might find that if you're, moving your eyes out to one side and you're starting to get double vision, we might simply just block the view of one eye on that side. So you've still got the peripheral vision out here, but you've blocked the central double vision part. And so they're able to learn how to just simply switch and get used to having that occlusion there. And because it's so close, the relief that you get from not having double vision in that field anymore can be quite remarkable, actually, because your visual system's designed for moving through the environment. You get some people where they might get double vision when they look down, as an example. And if you can sort of block out one eye in the lower field, they've no longer got double vision. They can be a lot more sure of themselves when they're walking around. And that's obviously pretty important, as we're discussing with elderly parents and falls. Yeah. That's a very important consideration, but it's also freedom too, that they're not restricted. They're not having to have someone hold their hand everywhere. So it can be quite life-changing, but it is one of those things that you bring on your skills and experience to basically, you work with the patient to explore what things you can be doing for their specific presentation, because everyone presents very differently with double vision, diplopia, again, particularly when we're talking about muscle restrictions from accidents, injuries, disease, and things.
So if I understand this correctly, so you're actually like adjusting parts of the lenses to occlude or to block out vision. So it's not like it's not a whole lens, or it's just a section of a lens. Is that right?
Yeah. So the idea is that you're just doing a section of it. So to avoid blocking that whole field unnecessarily, you might block just a part of it and we start with using frosted tape. It's really low tech stuff. Okay. And find the portion that what we're really looking for is trying to give us the biggest visual field, i.e. use what's the smallest amount of occlusion that maintains the biggest field and tries to drop the double vision as much as possible.
So, like, are there any maybe like less obvious ways to do that occlusion with a lens? Like, if you're walking around everywhere with some tape on your lenses, and it might be quite obvious.
Yeah. Look, sometimes it's a matter of moving the tape to the back of the lens, and that might be a situation where we don't use an anti-reflection coating on the lens, so the white reflections off the front of the lens tend to hide the occlusion. If it's really bothersome, we can use a more expensive kind of specific foil or filter that degrades the image, allows light through, but degrades the image enough that the brain can suppress that second image and ignore it. To be honest, a lot of the people that we're using this on, the relief they get from being able to have more freedom, visual freedom, they don't care what it looks like because they're at a situation where they've been battling some significant changes in their lifestyle. So they're quite happy to have the film there.
Let's talk about anti-fatigue lenses now. So we hear a lot about eye strain these days, digital eye strain. We're all spending more time on computers and looking at digital devices. So I've heard some people describe anti-fatigue lenses as being like reading glasses for younger people. And tell us a little bit about what they are and how you recommend them to patients.
The idea of prescribing a little bit of extra assistance at near is not new, and we can call them a reading addition or a near add. Anti-fatigue is a way of helping people understand that near work is not something we're designed to do for a long period of time. We've got I think a little bit of a soapbox of mine. We've got this incredibly sophisticated visual system designed to help us move through a three-dimensional world with two eyes, and we sit still looking at two-dimensional things instead as part of modern life. And so much like other parts of our musculature, our skeletal system fatigues, visual system's no different. So, and as I like to talk to patients, that your eyes are organs, because the fear is that people worry, oh, do you make the eyes weak by providing some assistance? And it's like, well, fatigue is overwork. Organs work all the time. Eyes are organs, and it's overuse that creates the problem. And it's a bit of an individual difference based on the way you go about doing your near work. How much intensity do you use, the sort of the tasks? But generally, if you spend a long time doing near work, you do start to get eye strain symptoms. And I've got the exact numbers in the research, but we're talking the majority of people, if they do a reasonable bit of device use or computer work, get some sort of eye strain. And so it's a modern twist on a modern problem. Back before devices and computers, it was the people who read a lot who tended to get eye strain. And I only had a gentleman in the other day who he was a tradesman, and he's now got a promotion. He's a supervisor and he's a manager now, and he's in the office and he's getting eye strain, because he's the way he works has changed. And so the idea of an anti-fatigue lens is that they show that with fatigue and eye strain, you start to get fluctuations in your focusing. And that's linked with what we loosely call, which is a group of symptoms called asthenopia, which can be headaches, eye strain, loss of concentration, those sorts of things. And the idea of an anti-fatigue is it's a way of providing you with some relief, take away a little bit of the effort up close. I like to call them an ergonomic device, much like having an ergonomic chair or an ergonomic keyboard to keep you in good posture and keep you comfortable. And the specifics about an anti-fatigue is it allows you then to be able to see across the room while you're wearing it. So it provides that support at near on your device or your iPad, and then still be able to see whether you've got a prescription, whether you need a prescription or not. Now, further, you use whatever you normally use to see clearly further away.
And I think there is a fair degree of confusion out there when it comes to anti-fatigue glasses. People talk about they need blue light glasses, okay? As in, we can talk about that, like lenses that cut out particular type of light, blue light. And so anti-fatigue glasses are not exactly that, are they? So there are some important differences there.
Absolutely. And an anti-fatigue lens is not just something you throw on too. I mean, it is something that's prescribed and carefully thought about based on the results of your vision exam. And it is actually a prescription that we add into your lens when we make it. So it's a custom, individualized approach. And then you've got lots of different coatings. So you've got plastic lenses have a soft surface, so they're easier to scratch than glass. You don't want to wear glass anymore because they break and they're heavy. So it's even harder. It's even hard to prescribe glass now. A lot of the labs just don't even supply it. So we have this plastic with a hard coating. So think of it a bit like your baked on 2-pack paint that they put on cars. It's quite tough, but it can still scratch, but it's still better than the underlying plastic that the lens is made from. And then, so hard coat's a fairly simple layer to reduce scratching. And then you get a thing called a multi-coat, which is also called an anti-reflection coating. And they're actually quite sophisticated. They're very, very small, thin layers, and usually anywhere between 7 and 9 layers to create this effect where you're getting a hard coating, but it also reduces the amount of reflections of that white light off the front of the lens. And a version of that is also, you can add in a filter for blue light. And so there's been a lot of noise made around the dangers of blue light for long-term eye health. And there's evidence that blue light interrupts sleep patterns. And so there is a place for the blue coatings, but I think some of it is a little exaggerated. There are many people who don't actually like the blue coating when you put it on their lenses. So we're always careful to show people the difference. And some people absolutely love it. They like that little bit of yellowing. They find it comfortable because they might have a light sensitivity. But that's very different again to the sort of fatigue that you get, which is your accommodation muscles, your ciliary muscles getting tired over time while you do near work.
So could you get a blue light filter added to your anti-fatigue lenses? So it's not
Yes.
it's not like it's not a mutually exclusive thing.
No, no. So you can have an anti-fatigue with a hard coat, with an anti-reflection coating, with tints, etc. And likewise, you can put a blue coat on any optical
Right.
lens.
Yeah. And I've heard some people talk about computer glasses as well. So I don't know if they are like an actual unique type of lens that's designed for looking at screens on arm's length away, or whether again people are confusing computer glasses with anti-fatigue glasses
Or even the blue light again, because
or blue light.
a lot of people buy blue light glasses for using the screen and using the computer. So there is a lens that there are lots of different labels out there, and a lot of it's just to try and convey. I'm sure some of it's marketing, of course, but a lot of it's to try and convey what they've done. So if you are advancing in years, like a few people that are close to home right now,
Yeah, nobody I know.
maybe even being interviewed on YouTube here, you start to lose your near vision, and it becomes less and less flexible over time. And
Yeah.
so, you might have a pair of reading glasses that are suitable for both your reading distance here and have no problem with the computer screen. But as your flexibility deteriorates further, those lenses for reading, become a lot less flexible in terms of their range, that they're now here, but you can't use them for the computer screen. So we have to use, you can call them an enhanced reading lens or an extended focus lens. Loosely, they're called occupational lenses because they're typically the type of lens I like to call them an office lens, because typically what it does is it puts in the upper half of the lens, around that sort of 60 to 80 centimeters away, and provides a nice big broad area for you to be able to look at your screen and your desk. And then it'll have an additional bit of reading power down the bottom for things that are closer, like your keyboard, your phones, bookwork, those sorts of things. And so there's a whole different variety of those extended focused or office style lenses that are available. And they have a good place, because when people start wearing progressive lenses, sometimes that middle zone that we might want to use for computers is a little small and restricted. And so, if you do a lot of computer work, sometimes you just need to get something specifically for it. It's a bit like putting a pair of work boots on when you go to work. Work boots are there for a reason. You can't wear sneakers at work, and vice versa. So,
That's a good analogy. All right. Well, if you're watching this and you found this content to be valuable so far, don't forget to hit the like button, because it really helps us out with the YouTube algorithm, and also hit the subscribe button if you'd like to be notified when Paul releases more YouTube videos like this one. All right. So we've talked about tints for migraines. We've talked about adjusting lenses for occlusion. We've talked about anti-fatigue lenses. Now, what about pattern glare? Because this is something that I really wasn't aware of until I started talking to you about this interview. So tell us more about what pattern glare is and how eyewear can address that kind of condition.
yeah. So there are a number of different conditions that can be considered under the banner of some sort of cortical hypersensitivity, where you sort of get almost a sensory overload. Migraine might fit in that category. Tinnitus, which is the ringing in the ears, kind of fits in that category. Visual snow is thought to be one of those sorts of things. And we've also got pattern glare. And so in the natural environment, we have these sort of multiple different patterns that are kind of chaotic's not the right word, but you don't get this kind of real regular pattern too often in the environment. And yet in artificial environment that we sort of tend to live in, we get these very strong patterns. So, like the doors behind you or patterns on my shirt, a lot more regular than what we see in nature. And it happens that print on a page can be thought of like stripes. And it happens that the most common range of size of text is also equivalent to a pattern that's found to be quite triggering for some people in terms of discomfort. And I like to go down little rabbit holes in the literature, and it's interesting to see lots of people talking about the same thing. And so you have different names that pop up in literature that can be called visual stress or visual discomfort, and pattern glare is another one. But they're all talking about essentially the same thing, that there's a certain size of pattern that people find visually uncomfortable to look at, and they create similar symptoms to eye strain. And in extreme cases, some people can find the flicker when you're driving in the car and you've got a line of trees and you get that light flicker coming through. Some people find that fluoros, they find the flickering uncomfortable. If you think of the grocery aisles, local supermarket, those very strong lines from the shelves, some people don't realize why they feel overwhelmed and uncomfortable. And so they're actually finding it's actually the stripes that in the environment are quite triggering. And it was discovered a while ago quite by accident, probably 40, 50 years ago, that some people find text a lot more comfortable to look at when they're looking through a tint. And there's still a lot of conjecture around why. Unfortunately, tints were then linked with reading disabilities, and it's not about reading disability, it's about looking at text more comfortably. If you've got a severe pattern glare, then it can seem quite remarkable how much easier reading becomes, that I can understand why it became a bit of a reading kind of cure in some circles. And what all it said was, for that particular person, they never had a reading problem to begin with. They just had pattern glare. You have a remarkable change. Reading wasn't the issue, it was the pattern stopping you from being able to read at your best. And there are pockets of research that demonstrate that people who suffer with visual discomfort or pattern glare do have similar accommodation or focusing problems to what we might describe an anti-fatigue lens for. And so we might find that if someone's got a bit of pattern glare, we look after their binocular vision and their focusing and their accommodation well, then their sensitivity to pattern glare might drop off. And so they become a lot more comfortable. But there are a certain group of people who remain sensitive to those patterns and find them quite triggering, and find that the only way they can get relief is by using a tint. So I have a fairly rigorous way of working people through that. So we're not just sort of prescribing tints willy-nilly like some sort of cure. We use that pattern I show you to sort of get a sense of, are they in that pattern glare sensitive kind of spectrum? Because if you use a larger pattern, so like a big grid like this, or if you use a smaller pattern, a lot of people are a lot less sensitive to that, even though that's harder to see. It's not as triggering. And so we've got a way of exploring and seeing who is more likely to have that genuine kind of what we call hypersensitivity patterns. And that's when we might explore, okay, what do we do? Are we just a matter of managing your focusing problems, or do we then need to explore a very specific tint? Some people can be very, very particular about the tint that settles the pattern glare down, whereas others might just need something sort of simple and grey to take the edge off things.
How prevalent is this pattern glare? Because it seems like something that might be like underdiagnosed in the community. So like what does the research suggest on that?
Look, a lot of these things seem to fit. And look, right off the top of my head with pattern glare, I would think it would probably sit in the sort of less than 5%. Visual snow seems to sit in that category. A lot of visual conditions sit in those smaller categories, and I'm sure if you were to be able to get the millions of dollars it would take to research it really thoroughly, that you probably find it's a bit of a spectrum. That I certainly believe that stress increases your risk of being triggered by patterns, and so I'm sure there's it's natural to be uncomfortable with those very strict kind of patterns. It's just that some people get triggered earlier than others, and if they've got other conditions they're dealing with, or they're stressed, or they're unwell, then they're more likely to get triggered. So I'm sure it's some sort of spectrum there. But yes, I'm sure it's probably in that less than 5% category, like what we see with visual snow and other things.
Right. Well, before we move on, I want to ask you about visual snow, because this is something that I've heard you mention a few times, but I'm not really sure what it is. So can you explain to us what is visual snow?
So there are people who experience static in their vision, and so those again, a bit of an age reference. If you remember the TVs, when the signal used to stop, you used to get static on the TV, so black and white, pixels everywhere, and so they see a form of pixelation in their vision, and it falls into two categories where you get sort of approximately, the research is indicating approximately half people have it for as long as they can remember, so it's something they've noticed since childhood. And then you get the other group, which I guess you would call acquired in some way. We sometimes see it in migraine sufferers. You sometimes see it people who've had concussion. There's question marks over whether some people have it triggered by some medications. There are certainly some types of static that are triggered by illicit drug use. They're not necessarily considered to be visual snow. That's a separate kind of condition. The actual syndrome, you can go to the Visual Snow Initiative website and they'll specify what it is. So to have visual snow, you need to have had the static present for a few months, and often you'll have other visual disturbances. So, if you see something move across in your environment, it has a little bit of a comet tail or an after image. Some people have tinnitus at the same time, so some hearing, the buzzing in the ears. And for some people, it can just sort of sit there in the background. But others, it can be quite debilitating because it actually covers up their entire visual field.
And so just like pattern glare, it's a condition that certain tints can help with.
It's still the recognition of visual snow, I'd have to say, is quite new. So that's something that's being explored on if you're a practitioner, then someone presents you trying to do your best to help them in any way. And so tints are something we might look at just to see if they get any response. And so if you have someone where they might try an FL-41 tint and go, I can't see my snow anymore, well, that's a remarkable change. Now, that's not, that's not everyone. That happens sometimes, but not super frequently. But that person's going to benefit from tint. So at this stage, it'll be a little bit trial and error.
Right.
We do have some emerging evidence that types of vision therapy may be beneficial in helping them improve their quality of life. It doesn't mean the visual snow disappears completely, but it can become a bit more of a background thing, so it's a lot less bothersome.
Okay. All right. Thank you for explaining that. Well, the last thing I'd like to talk about today is prism lenses. This is another thing that is new to me. So I understand prism lenses are connected with the treatment of binocular vision dysfunction. So can you tell us more about that? What are prism lenses? What is BVD for that matter?
Yeah, okay. Well, if we start with binocular visual dysfunction is a very broad term where you have issues with being able to assimilate the two information from the two channels together into a single clear perception. You might be achieving it, but it might be a lot of hard work for you. So in the background, you might be burning up concentration that you could be using on other things to maintain a single and clear perception of the world. It could create headaches, sore eyes. In some cases, some people get depth perception issues, get a bit of vertigo and dizziness, extreme sort of cases. So it's basically an eye teaming issue is the simple way of looking at it, but it covers a broad range of different labels of binocular of dysfunctions of binocular vision. And you might hear convergence insufficiency, convergence excess, convergence dysfunction. There's all different names, but it's just about binocular visual system not working efficiently. And if you take a fairly mechanical view of not being able to turn the two eyes in together, then you might use a prism to push the light in a particular direction so that you don't have to move your eyes far, and therefore it's less work to get the two images to work together. And the challenge with Prism is that it's thought to be, if we remember the classic Dark Side of the Moon album, go and Google it if you're not sure. And again,
Pink Floyd.
And so you see that prism and the white light hitting it, and then the light coming out the other side spread out. So a large prism will obviously spread white light into its very colors, but if you take a much narrower prism, that spread is a lot less obvious, and so it seemed to just bend the light. But they're actually very, very fairly simple prisms, but they're actually very complex optical devices, and so you need to be careful about once you start using stronger prisms that you're not inducing other kind of aberrations and things that people find uncomfortable, and that can be part of the limitation. Now, if you're dealing with certain types of binocular visual dysfunction, you may get some initial immediate benefit from prism feeling easier and more comfortable. But there is a term in optometry called eating prism, where because you're dealing with the what looks like a mechanical issue, and you're prescribing for it, you actually haven't really got to why the person might have developed the binocular dysfunction to begin with. And they start developing the binocular dysfunction again through the prism. So they come back a few months later wanting or needing more prism again and again. That's not actually solving the problem very well over the long term. And so we tend to use prisms for very specific situations. So our preference is if you are in a situation where your dysfunction's that bad, then maybe you might be a better candidate for doing some exercises or vision training and actually learning how to use your visual system better rather than just using an optical device to align the eyes. There may be situations where you have a physical restriction. So if we talk about, like we did with the occlusion, where you simply can't move your eye as well because of an actual mechanical restriction or some sort of loss of function, that's certainly where a prism can be beneficial to get someone, fusing and seeing single vision again. So they certainly have a place.
So, like, I've seen some images on Google of these prism lenses, and it is they are kind of noticeable, aren't they? They're like you can see actual like lines on the lenses if somebody was to take a close look at your glasses.
Yeah, so if you want to prescribe a fairly large powered prism,
Hmm.
they become very, actually, I'll probably have one here as an extreme example. These are flat prisms, so what we prescribe in glasses are curved. So that's what we consider a fairly large prism.
Hmm.
Okay. And you can see how it bends the light, moves the light there. Now, if we would prescribe that in a lens, obviously it becomes quite thick. And so there's a thing called a Fresnel prism, which breaks it up into little line segments. So you can put it on as a film on a lens. So the Fresnels have an advantage that even if you're wanting to explore the use of a low prism, you can put a Fresnel on without having to make a whole pair of glasses again to see what prism's needed. How does a person start to eat prism? Is it actually providing any benefit? Right through to, okay, well, we can't put a big prism in a pair of glasses satisfactory, so we use this film made up of lots of little lines of prisms to generate the effect.
I see. All right. Well, it's been some fascinating topics that we've covered today. Um, is there anything else that you wanted to add, Paul, before we finish?
No, no, I think we've explored that fairly well.
Well, I want to correct the record before we end. So in our last interview, we had that famous conversation about the octopus eyeball. You remember how through the miracle of convergent evolution, their eyeball is in some ways designed better than ours. I commended you for using the correct plural of octopi rather than octopuses. Turns out that the octopuses is the correct plural. It's got something to do with the Greek origins rather than Latin origins. If there are any linguists out there who want to explain that further better than me, please leave it in the comments. And on another level, I was wrong anyway because I said octopi was the collective noun, but of course, collective noun is like a herd of cattle, a flock of seagulls or something. And you'll love this. Do you know the collective noun for octopuses?
No, not at all.
It's it's a consortium of
Consortium.
octopuses. Sounds very very corporate. So I have these images of
Well,
like octopuses with their briefcases and ties going to work.
they're very serious looking, intelligent beings. So I think a consortium is probably an appropriate
Right.
term for a collection of octopuses.
Indeed. Indeed. All right. Well, so please tell us how can people get in touch with you at Harmony Vision Care?
Yeah, so we have the website harmonyvisioncare.com.au. We're based on the Gold Coast in Australia. If you're local, you can call us on 0755205900, or if you go to the website, you can contact us through the Contact Us page or even book online.
Hmm. All right. And yeah, so please follow Paul's Facebook business page to see him post updates on the latest news, promotions, and events at his Varsity Lakes practice. All right. So thanks a lot, Paul. And
Thank you. And just remember, everyone, good vision is more than just seeing clearly. And I hope what we did today highlights that.
indeed. All right. Well, until next month, everyone. So have a great day. Bye bye.
Fantastic. Thanks, Paul.